Immunology, study of the immune system. It is in the textbook. In this textbook is chapter 14. Page 76 of the note packet. Okay, let's stick with the notes for now. We'll flip to those pages in just a moment. You'll remember I said before that the cell membrane is what helps to keep things out of the cell that we want to keep out of the cell and keep things in the cell that we want to keep in the cell. That it is selectively permeable. It has the ability to allow some things to come through, whether it's by diffusion, the small particles, or if it has to go through a large gate, or if it's just a message that gets through. Well, our skin, we talked about last week, is the primary immune barrier that our body has. It keeps pathogens outside of our body. It keeps the stuff inside of our body we want to keep inside. The skin is the primary immune barrier, and for the most part, it does a really great job. Pathogens do not get past this very well. The only time we expect pathogens to get past this is if there's a break in this, or some sort of discontinuity, like a cut, a laceration, abrasion, maybe a puncture from venipuncture, even an incision, something done during surgery or an operation. That interrupts our primary immune barrier, our skin. So anytime we do that, we have to take special care, because now we have an area where pathogens can get into the body. Even if we don't break this barrier, we have ways that pathogens can get into our body. We have these openings, right? We talked about the head of your eyes, nose, and throat. Our eyes have that opening that goes into our nose. Our noses go into our pharynx, our throat. Our mouth, of course, goes into our throat. Our ears, we can even connect to the inside of our body. So we have all these different ways that things can get from the outside to the inside. That's just up here. If you think about the urethra, this is another way things can get inside of our body. This is the area where urine would come out normally. The anus, the vagina, all of these areas are where pathogens can get into the body. So we have to have some secondary immune response, something to sort of stand by. And we do in these areas. We have things like mucous membranes. These help to trap the pathogens so that when they get in, when you breathe in, you eat something, it gets stuck in those mucous membranes and we're able to cough it out or in some way get rid of it, or it doesn't get far enough where it can cause any damage. Then we have other areas, things like our stomach acid, which is very, very strong and can destroy pathogens. So if things get in, they bypass those other mechanisms, which they often do. If you imagine how small and light bacteria are and they're floating through the air, and you're eating something, it's not difficult to imagine that even if you just washed your silverware, it's still only a matter of time before some bacteria are going to settle on your food, and you're going to put that in your mouth and chew it around and then swallow it, and it's going to go into the stomach acid is going to kill everything. So, we have a lot of ways that we keep these pathogens from disrupting our body. But there are times where things do get past those other mechanisms. That's where we have to have our white response. These guys are the police. When they notice trouble, they come running. And there are several different types of white blood cells. We call them leukocytes. Leukocytes are white blood cells. Leukocytes are white blood cells. And they destroy pathogens. Remember we talked about pathogens? Any microorganism that's capable of causing a disease. That includes things like bacteria, viruses, protozoa, fungus, parasites, etc. Typically, which is smaller, bacteria or virus?
Virus.
Virus. Virus is very, 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 very small, right? And how do we get rid of bacteria? What do we use? What kind of drugs? Antibiotics. Do antibiotics work for viruses?